Welcome to internal medicine revision, the new structured under the new curriculum, that is internal medicine, coded as MEDG2110, that is for intermediate, simply means for second years. 120, that is for finalist. So this is how they flow. Then on the announcements, you'll be able to find some updates regarding the lectures. Then you can also go through the introduction to internal medicine roadmap. Already the roadmap for 2024 is there. That includes for intermediates and finalists. Under this block, we are going also to cover introduction to bedside medicine. So under introduction to bedside medicine, that's where we are going to learn who a clinical officer is, the roles of a clinical officer, especially for those that are starting the clerkships in the hospital. They have just passed the intermediates, now they are going into third year. What are the roles that they are expected to do? And how do you manage if you are stuck in the ward? You don't know what to do. You are exposed for the first time to a condition. How do you go about it? So under this block on introduction to internal medicine, we are going to revise on the appropriate history taking, physical examination, data interpretation that includes common laboratory investigations and how to interpret them. Also cover the radiological, where we cover the ultrasound, scans, x-rays, and all those imaging studies, when to order them, and how do you choose for you to come up with an appropriate diagnosis. So it will cover much of data interpretation so that you'll be able to know how to handle patients, how to handle investigations, and how to interpret the signs and symptoms. That's under this block. So we'll do a lot to do with procedures as well. Then from there now, that's when we're going to start Unit 1, where we're going to look at the high yield revision concerning with communicable diseases. So under here now, you also have a pretest. Even in the introductory part, you're also going to have some assessments here that will include the videos, the pictures, the sounds, and then you see how you'll be interpreting. Then when it comes to communicable diseases, we are covering the bacterial infections, viral infections, parasitic infections, fungal infections. So how it is to be conducted, you'll be having live lectures so that you're able to participate, you're able to ask questions. Also, there will be pre-recorded lectures, okay, where I have to record the lecture based on a question. So when I talk about pre-recorded lectures, these I'll be dealing with scenarios, I'll be dealing with short notes or exam questions. Then I'll be able to explain to them that's what we mean by pre-recorded lectures. So these are very important to attend. Then there will be also lecture notes, the one that I've prepared. Then there will be also quizzes, even assignments. You'll be requested to write assignments based on this program. So it's a very important program for you to attend, especially if you want to supplement or complement your lectures that you have been receiving from your schools and the one that you have been receiving from your wards. Okay, so as you know that this does not substitute for you to start missing your classes, to start missing your wards. No, this has just to complement so that you understand and prepare yourself. So that's what you're going to cover. So we have this pretest and our pass mark is 75%. Okay. So meaning that you have to ensure that you aim excellence, because we want all our members to attain excellence. So we have also a very practical lecture on how to administer attachment in clinical practice. So this is a pre-recorded lecture, but very important both for theory and OSCE. So you have to spend your time, listen to this lecture, okay? Then afterwards of this lecture, there will be some 2-3 questions to see if you are following. Then when you meet all the requirements under this unit 1, then unit 2 is going to open, where we're going to look at sexually transmitted infections. So each unit has got the questions, okay? After all the lectures, all the topics are done, then there are also assessments. So if you pass the unit, that's when you graduate to go to the next unit. So unit 3, we have got high yield revision on dermatological conditions. So here we're able to provide you pictures and explanations so that you'll be able to identify. Then unit 4, you have high yield revision gastrointestinal system. So here we're going to look at gastroenterology and all the conditions and the questions for exams. Okay. So I'll be able to tell you to say, okay, this is for intermediate, this is for finalist. So there will be that. So those intermediates, they'll be getting what they're supposed to get. Okay. Then we come to unit 5, that is high yield revision on respiratory system. So all the conditions. So this will be opening as we cover. Then unit 6C, we have the high yield revision, intermediate final level, cardiovascular system. Okay, so as you can see, these are the conditions that are there. We covered all these, but we keep on updating. So unit 7, we have high yield revision for genitourinary system. Okay, so you can see the lecture for AKI, acute kidney injury, is already there. Then upward to acute kidney injury, these are notes helping you to understand. Okay, and they are well summarized on point. Okay, then unit 8, you have high yield revision that we are going to talk about endocrine system. So we'll deal with all topics under endocrine system that are relevant for you as a clinical officer general, and as well as the questions that are relevant for endocrine system and the procedures. Then unit 9, you have high yield revision, hematopoietic and lymphatic system. So here we're looking about hematology. Okay, so we'll look at all the anemias, protoanemias, types of anemias, and then scenarios, lectures as usual. So this is what we're going to cover. Then we have unit 10, high yield revision. We are going to talk about central nervous system, that's neurology. So all the topics under the central nervous system that are common in clinical practice in your syllabus are all covered, and we'll be telling you these are for the word-based, we'll be telling you these are for exams. Then unit 11, you have high yield revision, musculoskeletal system. So we are covering in a triad. So a triad is like a 3-way. We'll tell you what is intermediate level, final level, and then that's part of examination level. We'll tell you about the aspect of the clinical aspect, hospital level. We may also look at what key areas we may be also concentrating for licensure exams. Then unit 11 as well, we're talking about musculoskeletal, that's also rheumatology. Then unit 12, high yield, that's where we cover HIV and AIDS. We are talking about HIV medicine. So we'll give you the updates, what's there to the current practice, and then also for the examinations. Then after that, now you have now all your time to do your high yield level revision block guides. So this is where now we practice for questions, for exam questions, OSCE questions, quick guides, so that now we have covered the entire syllabus of internal medicine. Now you need to have quick guide to revise. After the revision is done, then all for final and intermediates, OSCE inclusively. No intermediate, now you have got OSCE. Then now you come now high yield specifically for intermediate. So this one is only for intermediate class. So the intermediate class, now you're going to test yourself on high yield intermediate level. So you are going to be assessed, also being given feedback, assessed, being given feedback, and from there we have got what we call a must know that we're going to provide. Now it means now made ready for your exam. No need of shivering, no need of panicking. Then for finalists, this is for finalists, no intermediates, because these are totally different aspects. So for finalists, you have to attempt. So only finalists will be able to access the finalist level. Okay, in certain key areas that will be for final exams, only finalists will be able to access. So this is how it is. So even the schedules of timetables, there will be those where you meet together, and there are those that you'll be doing separately, finalist and those in second year. So this is all about a guide. So you are invited to create an account if you have not created one. If you have, you are invited to enroll into your course. So thank you very much. You are welcome to this guide.